patient appointment, passive ranges of motions, submaximal stretching where we don't go into the end fields or beyond, oscillations, fast rate effleurage and petrissage, partial cutting, and fast rate stroking. And this is usually done through clothing. We normally focus only on those body parts that are immediately involved. So for more athletes, it's the legs. We focus on the big muscle group, the hamstrings, the quads, the calves. And if we discover something during the course of action, like if we discover that the client has hypertonicity or scar tissue or adhesions or trigger points, we don't treat, we save it for later, okay? Because the athlete is going to be participating in the event soon. Any type of depth that may produce inflammatory response is not something that we want to do. So the pre-event massage stays not only fast but relatively superficial. Okay, we don't achieve depth. It's relatively short. You would spend maybe 5 minutes on each leg in prone and supine position. So ultimately the entire routine may take 10, 15 minutes and that's it. And the effects or the objectives are again listed on this little page. You want to increase circulation, warm up the muscles and the connective tissue around the muscles. You want to promote the sympathetic response, increase neuromuscular response, meaning that we don't want to do relaxation massage obviously, which is doing the opposite. We want to stimulate. It prevents the injury, of course, because the muscles and the connective tissue are better prepared for action, and it also prepares it's supposed to prepare the athlete for the event mentally. So if you are in an event, you often see, like normally when we are doing a massage, it is considered unprofessional for the therapist to initiate conversation, right? So unless the client wants to talk to us, we don't talk. We just ask them, how's my pressure? Are you okay? How's the pillow? Right? Whereas in sports massage, you will see the therapist talking about the event, about the competition, and the whole time during the routine, telling the athlete how good they are, how they are going to kick everybody's butt, how they are better than anybody else, and such, when they are trying to prep them up mentally. So that's why there are unfortunately not that many opportunities for pre-event massage. Every event, everything from as big as the Olympics or small as local hockey competition, is usually responsible for hiring a medical team for the event. And the medical team usually consists of a doctor, nurse, paramedic, massage therapist, chiropractor, physiotherapists, who are there available for the athletes. And so if you want to participate in these events, you simply have to get a schedule of athletic events in the province or in the country, call the organizers and ask them if they need massage therapists on the site. However, most of these events, they usually work on volunteer basis. Right? The therapists who participate in these events, they sometimes or often, and even like at the Olympics, like I have a couple of good friends who were doing pre-event massage at the Olympics, and they didn't get paid for it, right? They just did it for several days. They have to travel abroad, and it increased their profile. But many therapists are doing this to simply increase their profile and get the clientele and hand out business cards. Okay, do you guys have any questions? Okay, so let's